evening, everybody. I shall be discussing a few important aspects of stroke. Um, let's say that stroke is a very common term which you have almost everybody has heard about it. It means a brain attack, just as a heart attack. It's a brain attack. So something which is causing disturbance in the blood flow of the brain or blood circulation, let us put it in this way, of the brain can cause damage to a certain area of the brain, and that is called stroke. Very commonly, people misinterpret certain issues as stroke. For example, transient, say, passing out or loss of consciousness or even convulsions, etc., which are features of epileptic attacks, are sometimes misdiagnosed as stroke, misinterpreted as stroke. So, for conceptual purpose, I am highlighting the fact that stroke is a brain attack, which means somewhere some sort of disturbance in the circulation of the brain, blood circulation of the brain. So let us now come to the types of the stroke. So one is in medical language known as ischemic stroke. It means ischemia to the brain, that is poor blood circulation to the brain. So the blood vessels or the arteries which take blood to the brain are designed in such a way that there is a smooth flow of blood to each and every area of the brain. Now, this can get compromised because of certain reasons, for example, age or etc., which we will come to later on. Whatever the reason is, that some area of the brain is suddenly getting devoid of blood circulation, so that area gets damaged. So one thing important is that a particular volume of brain tissue or neural tissue, if it gets damaged, it's a permanent damage. But what happens in this kind of stroke is that the entire area which suffers from lack of circulation is not damaged as a whole. So a part within the central area may be completely damaged, but the part which is outside that area is circulating, the circulation is impaired over there, which can be restored, and that area's function will be restored. So that is the whole idea of treatment of stroke nowadays. And the second type is hemorrhagic stroke, which means that there is, due to some reason, rupture of the blood vessels within the brain, again to a particular area, and the most common cause for this is high blood pressure or hypertension, and there are laid down areas of the brain which are damaged because of high blood pressure and leading to rupture of the blood vessels. So they can cause individual symptoms related to that particular area, which I'll come to a bit later. And a third and important type of stroke is embolic stroke. It means that the heart is in some way responsible. So either the heart rhythm is not normal, it is either very fast or very slow or irregular, and that causes certain clots to be certain clots which occur inside the heart, and they are pushed into the circulation. So that most important area where it can cause damage is in the brain. So these clots can go to multiple areas of the brain, and multiple areas of the brain can get damaged. And one important aspect to remember is another type of, individually it is a separate chapter in neurology, which is stroke in the young or in young population. Young doesn't define a particular age group, but definitely less than what is the usual age group, which is more than say 50. So nowadays young means say about 25 onwards. So we get a lot of patients of young age, 25, 30, 35, who can suffer all these three types of strokes. So there are certain laid down causes for young onset of stroke, which is separate from the risk factors for adult onset, ischemic, hemorrhagic, or embolic strokes. So young onsets may be certain disorders of the blood. It may be because of hypercoagulability or stickiness of the blood, because of certain reasons, blood related problems, etc. And one interesting thing which has been observed over the last couple of years is that post-COVID, the entire scenario of vascular damages have changed. So young onset strokes, young onset heart attacks, young kidney damages are already common nowadays, and mostly related to those patients who have suffered COVID or to those patients who have taken vaccine which causes vaccines for COVID, which are known to cause increased coagulability. So now let's come to the symptoms. How usually a patient with stroke come? That can be depending, as I said, depending on the certain area of the brain which is getting damaged. So the common areas which cause damage lead to sudden onset disturbance in the vision, sudden onset disturbance in the speech. The patient may lose totally speech, or the language may become distorted. Then particular area of the brain causing loss of power of the other half of the body. So the brain is crisscrossed. So this right half of the brain suffers the left half of the body, and vice versa. So if there is a damage to the right side, there will be damage to the left side of the body. So the patient may have a complete paralysis of the upper limb, lower limb, as well as part of the face. And there will be different permutation and combination, so giving rise to different types of, say, that this half of the face is affected, or this half of the vision is affected, or this half of the movement of the eye is affected, along with paralysis or no paralysis. There will be sudden severe dizziness. So a patient who is coming with severe dizziness, most likely they are diagnosed because of some problem with the ear. But if the patient is an elderly with having risk factors for stroke, so this has to be kept in mind. So this dizziness may be associated with severe vomitings or sometimes with other ocular disturbances. Now, as I said, one thing I would like to highlight, that what is the sort of vision? So usually, sudden loss of vision of one eye, it is also a type of stroke, but a very rare type. The common things is that one half of the field of vision, say for example, the person sees properly the things. Like for example, the light is going, the picture is going to the eye. So a face is there, a man is standing in front of you, but the person cannot identify whether it's a human face or whether it is a block of wood. No, because the area which reads that within the brain is getting damaged. So the stroke is that area of the brain causing damage. So this is known as cortical blindness or blindness in the patient, in the sense that the patient can see actually, but actually the patient is not blind. I mean, if you test him, he'll show all the parameters of the eyes which are functioning normally, but still the patient can see. So the patient actually sees but cannot decipher what he is seeing. So this is the kind of important thing which is in the symptoms. And I told you that if it comes, then be cautious about that, whether the person is having a stroke. Now, given these things, so if the patient has any of these individual things, the patient is immediately rushed to the hospital. Now, what I would highlight is that in these days, in the management of strokes, the scenario is different. Since the last 20 years or more, the most important idea was that to restrict an amount of brain damage because of poor perfusion or poor flow of blood. And that can be done by dissolving of the clot. So this is a process known as thrombolysis, which can be done by an intravenous injection or medicine. Or another aspect which I was highlighting in my few, if you go through my few slides in the last few Facebook pages, Facebook posts, you will see that there is a term which I have used, that interventional neurology. So intervention is now top of the day. So somehow mechanically, to crush down that clot, to bring it out, can be done. But the time frame is important. So the time frame in different areas of the brain happens to be a bit different. But mostly it ranges from 3 hours to 4.5 hours. Or sometimes it can extend, but a maximum of around 6 hours. So that time frame is important. So that means that the patient identifying the symptoms has to be rushed to the hospital, and not just rushed to the hospital. If the patient brings the hospital and an ambulance goes, even the ambulance driver and the ambulance team should be trained enough to do that part within its framework. So this is all about the advantages of modern medicine is that all communication system and everything is that to save the area of the brain. So time loss is brain loss. So that time is very important, as I mentioned, that period of time. It's true with hemorrhagic strokes also. If the hemorrhage is significant enough, the patient may be bad from right to onset, or sometimes the hemorrhage keeps on going. So if the patient may have a bit of discomfort or problems in the upper limb, and then suddenly it gushes to a whole sort of left-sided or right-sided paralysis. So that means that the hemorrhage also, in that case, blood pressure control is very, very essential as early as possible. And there are time frames, there are laid down criteria as to how much blood pressure should be reduced or not. Because in ischemic strokes, there is a restriction that blood pressure should not be significantly reduced. So these are, I'm not going into details on that because they are in the prerogative of medical discussions. So I am discussing this for the awareness of the general public. So if at home you find that these symptoms are there, be aware that time is very important and immediately you should rush down the patient. Get to know what the type of the stroke is and intervene as early as possible. Now, I'll highlight a bit of this was about the treatment part, and for the medicines, of course, I'm not going to detail because these are just they are given on for further damages to be prevented. Because if a person of stroke is for the first time, then there is every chance that the person will have another stroke within the next 7 days, next 1 year, next 5 years. That way. So there are medicines to keep the blood diluted so that the flow can be improved. There are medicines to improve the quality of the blood vessels. That means the medicines which will interfere with your cholesterol metabolism, and this is very important. One thing I will highlight to is that patients with normal cholesterol need not be very happy because it's not the level of the cholesterol within the blood which is important. It's the type of the cholesterol which is important. So LDL is a particular cholesterol which is very important. If it is high, it has to be controlled. HDL is a good cholesterol. If it is low, it has to be improved. So there are medicines which are known as statins and different types of statins which do this needful. They improve your HDL, they will reduce your LDL, whatever. And even if it is normal, these medicines have to be continued because these medicines just don't reduce your cholesterol. They just don't work with your cholesterol levels. What they do is they improve the quality of the blood vessels. So just like an old rusted pipe at home. So you cannot improve the quality of that pipe. You cannot change it. You cannot change that blood vessels. What you can do is you can put in a stent or you can put in another tube within that pipe which will improve it. So that is by intervention. And by medicine, you will sort of improve the quality of the wall of that pipe so that the blood flow that will be done by the statin. And again, the blood flow normally, to do that, you give blood thinners. So I think grossly, this is the idea which you should keep in mind. So, and the most important thing right now, and last thing which I will discuss today, is about the prevention. What about the prevention of stroke? So one must remember that there are modifiable risk factors and non-modifiable risk factors. So the non-modifiable risk factors are those which you cannot modify. Say suppose, for example, if stroke runs in the family, the person is genetically predisposed. So genetically means how? So there are certain cholesterols in the blood which are genetically high. You cannot lower down them by statins. So you just can't. So what happens is that if these persons are predisposed, you better take care of the modifiable factors more rigidly. Then, for example, non-modifiable factors, say being a male or being a female, the female is usually protected till her menopause. But after menopause, when suddenly the good hormones like estrogens, they are not in the blood circulation properly. So then the females are exposed to more, probability of stroke. So they should be careful. Then coming to the modifiable risk factors, which is very important, and one must know what are the modifiable. So modifiable risk factors are like say diabetes, blood pressure. So these can be there within the patient. These are risk factors. So these are all controllable, modifiable. So if you have a diabetic, take control of your diabetes. And I would say that take control of your diabetes means that you should at least once in your lifetime go to an endocrinologist and get a proper understanding of what your disease is. Of course, all people may not have access to an endocrinologist. So for that, they have to go to their general physician or a physician in general. But at least one attempt should be made to go to an endocrinologist because one should know what are the diabetic problems which will come in life, not just two. So that's then a control of blood pressure. So very usually what we see is that young patients nowadays, they have blood pressure problems. That has to be controlled. Cholesterol, as I said, that has to be controlled. Of course, smoking, drinking, these are all, drinking has a certain limit. So up to a certain limit is allowable per week. But if a person crosses that, he is exposing himself to vascular damage. Smoking, of course, each and every cigarette which the person is smoking is causing dangers. Danger in the sense that the blood pressure may be raised, the walls of the arteries are getting spoiled. So smoking is something which has to be. But drinking, of course, social drinking may not be an important risk factor, but regular unmatched drinking is definitely a risk factor. And then there are certain illicit drugs which are, I won't discuss that here. There's substance abuse which have a increased propensity for strokes. And one very important thing this today is important is the lifestyle. So eating all sorts of junk food or not doing exercises properly, not having a healthy lifestyle is something which is definitely a risk factor for any types of stroke. Not only ischemic but also hemorrhagic also. And as regards embolic strokes, of course, one should be aware of the fact that a person has heart problems and the cardiologist will guide you how to prevent your strokes from your heart. So there are medicines to do that. Regarding the healthy habits, so get up early, go to sleep early, take a proper sleep, watch whether there is a disturbed sleep, because this is an entity which is very, very commonly missed. And this is known as obstructive sleep apnea, which is a very, very important factor, risk factor for both ischemic as well as hemorrhagic strokes. So if a person has disturbed sleep, must consult a physician, and the physician must guide to a pulmonologist or a neurologist to get a sleep study done, establish the fact that yes, the person sleep is not just a nominal sleep sort of problem, insomnia or this kind of stuff, but it is because of that particular disease which is causing increased propensity for stroke. So that has to be corrected. Then eating fruits and vegetables, plenty of antioxidants for common things like, for example, spinach, carrots, potatoes, which contain a lot of these antioxidants. Then micronutrients, fruits are the wholesale supplier of micronutrients. Instead of buying a vitamin capsule for 10 rupees, you have an apple a day. As it usually says, that apple a day keeps the doctor away. That's very true. So eat healthy, live healthy, don't take stress, get your stress to blow out, get stress adaptations done. So yoga and all things, what are they? They are just concentration and relaxation exercises. So who isn't in stress today? Every professional in every field is in stress. But the way the person manages that stress, the way person adapts to that stress is very important. It's not that if you have a night job or if you have a 12 hours job or something, it's stressful. No, you can still have relaxation within that period. So you must know how to do that. So for that, you keep in touch with yoga people, you keep in touch with people who are, coming in the media and all these things. So do that and make a proper healthy lifestyle. Because these factors will be there. These modifiable or non-modifiable risk factors. You cannot prevent a diabetes, you cannot prevent a hypertension, but you can manage it. You can definitely prevent a stroke from happening from that, which are known as target organ damage for diseases. So overall, I think I have covered more or less, the understanding of a stroke, what the stroke types are, and from now on, keep one thing as a take-home message is that time is brain. So time loss is brain loss. So immediately if you see a patient at home having these symptoms at home or at office or whatever, you try and consult or contact the immediate medical services which you are afforded, and definitely get in touch of a proper center with neurological facilities, both neurological, neurosurgical, interventional neurology, all these things together, put together in a sort of hospital or facility. Get in touch with them. It may be in a government setup, it can be in a non-government setup, doesn't matter. But you must try and make your person reach there somehow. But for primary healthcare, say for example a person staying in a hill or in a mountain or in a very remote area, how do that manage? So proper education of those people, time to time, doing camps over there. For the general physicians, I would suggest this. For the physicians, I would suggest to go there, talk about these things, so that at least at home, whatever they can do is the basic management which can be done at a primary health center. Be done to that patient, that much good to be done, and transfer that patient immediately to a tertiary center. So I think I've covered more or less, and I will definitely expect that if you have any questions or if you have any further queries and all, I'm always available in my Facebook page, and I come up with 2 posts every week. So you can definitely put in your queries, you can definitely put in it as a comment. Best of luck, and definitely have a good life. Next tomorrow, a good morning. Very good morning for you for next tomorrow. Thank you very much.